Welcome back our fans. General anesthesia in oral and outpatient surgery. Definition. It is a medically induced coma with loss of protective reflexes, resulting from administration of one or more general anesthetic agents, carried out to allow medical procedures that would be intolerably painful for patient. A variety of drugs may be administered, with overall aim of unconsciousness, amnesia, analgesia, loss of reflexes of autonomic nervous system, paralysis of skeletal muscles. 2. Types of general anesthesia. 1. Outpatient anesthesia. Idental chair anesthesia. Relative analgesia, for simple extraction. Day care anesthesia. Conscious sedation, for minor oral surgery. 2. Inpatient anesthesia. Intubation with or without neuromuscular blocking. For complicated extractions, oral and maxillofacial surgical procedures. 3. Indications for GA. It should be strictly limited to patients in which local anesthesia, with or without sedation, is not an option. Acute infection, pain. Children. Mentally disabled patients. Dental phobia. Allergy to local anesthetics. Extensive dentistry and maxillofacial surgery. 4. Equipments. 1. Anesthesia machine and vaporizers. 2. Oxygen and nitrous oxide. 3. Breathing circuit, adult and pediatric, is a medical device used to deliver oxygen, remove carbon dioxide, and deliver inhalational anesthetic agents to patient. 4. Masks, anosal and facial. 5. Airways, anosal and oral. 6. Laryngoscopes with all sizes of blades. 7. Tracheal tubes, nasal and oral. 8. Independent suction apparatus. V. Monitoring standards. 1. Peripheral arterial oxygen saturation. 2. ECG. 3. Non-invasive blood pressure and capnography. 4. All resuscitation drugs. 5. Defibrillator. By teamwork. Anesthesiologist. Dedicated assistant. Dentist/surgeon. His/her assistant. Minimum of 4 people are required. Written consent by patient or parent/guardian should be done. 7. Procedure only. ASA physical status class I2 patients should be administered. Steps. 1. Pre-anesthetic preparation. 2. Premedication. 3. Induction of anesthesia. 4. Intubation. 5. Maintenance. 6. Recovery. 1. Pre-anesthetic preparation. Preoperative examinations are indicated. Physical examinations, by anesthesiologist. Blood tests, CBC and coagulation profile. Urine tests. Liver function test. ECG. Lung X-ray. Informed consent form. 2. Premedication. Preoperative fasting, clear fluids are allowed up to 4 hours children, or 6 hours adult. Anxiolysis. Benzodiazepine, midazolam. Dormicum, alprazolam Xanax. Sedation, amnesia and anticonvulsive drugs. Analgesia. NOA, non-opioid analgesic, diclofenac, ibuprofen, paracetamol. In case of need opioid, tramadol, pethidine. Antacid. H2 blocker, ranitidine. Proton pump inhibitors, Nosotrat. Antibiotic prophylaxis. Ampicillin/clavulanic acid or amoxicillin/sulbactam or clindamycin. 3. Induction of anesthesia. It is transition from an awake state to an anesthetized state. Gaseous induction using sevoflurane, -66% nitrous oxide and oxygen, halothane, in addition to 4. Induction drugs used in intravenous anesthesia. Benzodiazepine. Dose-dependent anxiolytic, sedative and hypnotic. Relative contraindications: obesity, hepatopathy in older age patients. Propofol. Lipid emulsion used for induction of anesthesia. Onset of 30-45s. Duration of hypnotic effect 4-6 minutes. Elimination half-time 1-3 hours. No analgesic effect. Side effects: apnea and hypotension. Barbiturate, thiopental, tropinol. No analgesic effects. Onset of 2050s. Duration of hypnotic effect 5-10 minutes. Elimination half-time 5-10 hours. Laryngo and bronchospasm, histamine release. Contraindication: asthma, allergy and severe liver damage. Nalbuphine Nubane. Belongs to opioid analgesics. Duration of action is approximately 2 to 3 hours. Thanks for watching. Support us by likes and subscribes.